Hi Daphne, my name's Natalie. I'm a student nurse at Valdosta State University. Can you state your name and date of birth for me, please?
Daphne Foster, June 15th, 1992.
Okay. Today we are going to do a head-to-toe physical assessment on you to get your baseline since it's the first time at this hospital, okay? Okay. So I'm going to go ahead and get started. I'm going to start with your head. Your head is erect and midline. There are no lesions or edema. Can you tell me if this is tender?
No.
Okay, so no tenderness or lesions on the head. And, okay. Can you close your eyes and tell me where you feel these sensations?
Forehead,
Okay,
cheek,
okay. That is cranial nerve 5 is intact. Sorry, just have to pull that closer. Okay, now can you puff your cheeks, clench your jaw, and smile? Okay, that cranial nerve 7 is intact. Now open your mouth, okay? No TMJ is present, no crepitus or clicking. Okay, now I'm going to move on to your eyes. Sclera is white with no lesions or tears. The iris is brown. Pupils are 3 to 5 millimeters in diameter. Conjunctiva is pink and intact with no lesions. Okay. I'm going to check your red reflex. Okay, red reflex is present. Okay. Now can you hold this 14 inches away from your face? Cover up your left eye and read this line right here.
428365.
Okay, now cover your other eye. Read this line.
428365.
Okay, now uncover both eyes and then read this line right there.
374258.
Okay, vision is 20/20. Okay, look straight ahead. Okay, pupils are equally round and reactive to light and accommodation. So cranial nerve, oh, I'm sorry. Let's follow my finger, okay? No, don't move your head, just follow with your eyes. Okay, cranial nerves 3, 4, and 6 are intact. Alright, so now I'm going to move on to your ears. Okay, Okay, so tell me if you hear this noise equally or equal in both ears, or if you hear it more in one ear than the other, or if you don't hear it at all, okay?
It's equal in both ears.
Equal in both ears? Okay. Alright, so now I'm going to strike this again, and I'm going to put it against your bone, and whenever you stop hearing it, let me know.
Now. Now.
Okay. I'm going to do the same thing in this ear.
Now. Now.
Okay. Air conduction is twice as long as bone conduction in both ears. Now I'm just going to inspect your ears. So the outside of the ear is intact. There is no drainage, edema, or redness. Let me know if you feel any tenderness.
No.
Okay, the tragus, helix, and mastoid have no tenderness. Alright, there's no lesions or edema. I can see the pars phallia, the pars tensa, the malleus, and the umbo. The cone of light is on at 5 o'clock in the right ear. And the tympanic membrane is pearly gray with no lesions. And it is bright and mobile. Okay, I'm going to check this ear for the same thing. Same findings in this ear. The tympanic membrane is pearly gray with no lesions or edema. I can see the pars vallia, the pars tensa, the malleus, and the umbo. And the tympanic membrane is mobile. The ear, the outer ear, the tragus, the helix, and the mastoid have no tenderness. Okay. Okay, so now I'm going to move to your nose. Oh, I need to. I forgot something in one of your ears. The cone of light on the left side was at 7 o'clock. Okay, so now I'm going to check your nose. Okay, the turbinates, the inferior, middle, and posterior turbinates are all intact. The mucous membranes are pink and moist with no edema or lesions. Can you close your eyes, please? Okay. And can you identify that smell?
Alcohol.
Okay. Cranial nerve 1 is intact. Now, can you open your mouth for me? Okay. Mucous membranes of the mouth are pink and moist. Stinson's Wharton's duct under the tongue is intact. The Stinson's ducts are also intact. Teeth, there are 28 teeth that are all white and even. Can you stick out your tongue, please? The tonsils are +1. Gag reflex is intact. And there's a symmetrical rise of the uvula. Cranial nerves 9 and 10 are intact. Okay. Can you close your eyes, please? Okay. Can you identify that taste?
Sweet.
Sweet? Okay. Alrighty. Now I'm going to move on. Cranial nerve 7 is intact. Okay, so now I'm going to move on to your neck. Can you lean back for me, please? Just your neck, yeah, sorry. Okay, the trachea is midline and no deviations. And can you swallow for me, please? Okay, and swallow. Okay, the trachea is mobile. Okay. Now I'm going to listen to your carotid arteries. First I'm going to palpate them. Okay, carotid artery is strong. Okay, I can hear the carotid arteries equal bilaterally. There is no venous hums or bruits. Okay, so now your lymph nodes. Occipital, post-auricle, pre-auricle, tonsillary, submandibular, submental, inferior, the inferior cervical, the posterior cervical, and the deep cervical lymph nodes, and then the supraclavicular and the infraclavicular lymph nodes. Did you feel any tenderness? Okay, so no tenderness noted, and lymph nodes are non-palpable. Okay, skin is intact. There are no lesions present. skin is warm and dry to the touch and is darker in exposed areas than in non-exposed areas. Okay, I'm going to inspect your chest now. Okay. Respiratory excursion is equal bilaterally. Now can you turn this way for me? Thank you. Okay, take a deep breath. Okay. Respiratory excursion is equal. Hold on. Okay. Can you say 99?
99.
Okay, tactile fremitus was felt until the thoracic cage. You can turn back towards me now. Okay. Percussion on the right side was felt until the fourth intercostal space. Resonance was felt on the left side until the second intercostal space. Okay, can you turn back? Sorry. Okay, resonance was felt from T10 to T12. Okay, can you turn back towards me? Sorry. Now I'm just going to listen to your lung fields. Take a deep breath. Okay. Deep breath. Deep breath. Okay, and one more deep breath. Okay, deep breath. Deep breath. Deep breath. And one more time. Okay, all four lung fields were clear to auscultation. There were no adventitious sounds, no bronchi, or anything like that. Okay, so I need to listen to your heart now. Okay. Aortic. Pulmonic. Tricuspid. And mitral. Okay, S1 and S2 were auscultated in all of the heart fields. There was no S3, S4, or any heart murmurs. Okay. Can you lie down for me, please? Okay. Hair on the abdomen is evenly distributed. There are no lesions or edema. And skin color is normal. Okay, now I'm just going to listen to your abdomen sounds, okay? Bowel sounds were auscultated in all four lung fields. There was no clicking. Now I'm going to listen to the heart sounds. Your aortic, renal on either side of the belly button, and iliac. Okay, there were no bruits or venous hums. Okay, so first I'm going to do first I'm going to percuss, okay? There was timpani felt in there was timpani heard, excuse me, in all four of the quadrants, and then there was dullness felt over the organs. So now I'm going to do palpation, and I'm going to do a light palpation first and then go into a deeper palpation, okay? Let me know if you feel any tenderness. Okay. No spleen felt, and I can also not feel the liver, which is a normal finding. Okay, you can go ahead and sit back up. Okay. Now, I'm going to go ahead and listen or feel for your pulses. Okay. Brachial pulse, radial pulse, brachial, radial, pedius, and posterior tibialis. Okay, all pulses were felt with a +2 in strength. All right, can you go ahead and stand, or, yeah, go ahead and sit back down, sorry. Okay, so now I'm going to do your deep tendon reflexes. Can you flex your arm out? Like this, okay. Okay, that is the bicep deep tendon reflex. Now, tricep deep tendon reflex. The Achilles and the tibial. All reflexes are +5. Go ahead and stand up. Okay, and then we're going to do lift your shoulders against my resistance. Okay, and then now turn your head towards my hand. Turn your head towards my hand. Okay, cranial nerve 11 is intact. Now we're going to do the range of motion for your extremities. Okay, so move your head from side to side. Okay, and then hyperextend your neck and flex your neck. Full range of motion in the neck. Now put your arm up and down, come towards the middle, up, down, and now move your arm in a circle. Okay, yeah, do the same thing on the other arm, up, and then move it in a circle. Okay, now extend your arms and flex at your shoulder, your belly button. Okay. Okay. Now bend at your waist and come back up. Hyperextend. Bend in your waist and hyperextend. Okay. Spinal range of motion is intact. Lift up your leg and move it out to the side. In and out. Now extend your leg and then hyperextend. Yeah, there you go. Okay, and do the same thing with the other leg. And move it from the inside, or sorry, move outward and in. Okay. Now, okay, so move your arm outwards against my resistance. Okay, outward against my resistance. Okay, same thing with this leg, move outwards, and then move outwards. Okay, +5 on the muscle strength for the extremities. Go ahead and hold out your hand. Okay, can you identify that object?
Coin.
A coin, okay. Now on the other hand, identify that object.
Key.
A key, okay. Trigenius is intact. Sensory is intact, excuse me. Okay, now close your eyes. Okay, negative Romberg test. Neurological coordination is intact. You can open your eyes. And now just move your hands. Okay, coordination is intact. Okay. Alrighty, we're done. Thank you.
Thank you.